Hi everyone, welcome to the GPE webinar series. My name is Stuart Cameron. I'm the Equity and Inclusion Thematic Lead of the Global Partnership for Education, and I'm here at the GPE Secretariat in Washington, DC. We're also joined by a wonderful panel of experts who are joining us online. So a bit of background, GPE's webinars started in 2016. They're part of GPE's Knowledge and Innovation Exchange, or KICS initiative, that came about as a response to GPE's partner countries' request for additional opportunities to exchange knowledge, good practice, and policy approaches that inform education policies and practices at the country level. The webinars also give practitioners the opportunity to engage in a continuous practice of knowledge exchange between partner countries, which in turn strengthens and fulfills the national and global objectives of GPE. So this particular webinar is the second in a series that will focus on collecting and using data on marginalized groups for education that we're going to be running in the coming months. This series will tackle issues such as how to identify disability and measure inclusive learning environments, the role of community and citizen-led initiatives, and the use and limitations of new technologies in gathering better data. And our main aim is to convene key partners working on these issues and to foster collaborations that can hone and apply new ideas. So before we begin this session, I'd like to draw attention to a few housekeeping items. If you are facing any connection issues, please let us know via email at webinars@globalpartnership.org. We will have a question and answer session after the presentations today. So feel free to keep sending your questions through the webinar via YouTube's live chat feature, or if you prefer, you can send them by email to the same address. That's webinars@globalpartnership.org. We'll try to get as many questions as possible in during the question and answer session. Please do let us know your name, your organization, and the name of the presenter or speaker to whom the question is directed. This session is also being recorded, and we'll send everyone who participates today the resources associated with the webinar and a link to the recorded session. So today's webinar is called Inclusion of Children with Disabilities in Education. What can we learn from new household survey tools? The topic of data on inclusive education for children with disabilities is of particular interest for us at GPE because equity and inclusion is at the heart of our vision of ensuring inclusive and equitable quality education and promoting lifelong learning opportunities for all. GPE also supports the Convention on the Rights of Persons with Disabilities, which most GPE partner countries are signatories to, in particular in its insistence that governments must ensure that children with disabilities are not excluded from the general education and can access an inclusive, quality and free primary education and secondary education on an equal basis with others in the communities in which they live. At the Global Disability Summit in 2018, GPE made a number of commitments, one of which was to support improvements on data on disability at the country and global level, in particular in partnership with the UNESCO Institute for Statistics. So in this webinar, which also marks the International Day of Persons with Disabilities, we're going to be highlighting new research and methods that speak to that commitment to improve data for on children with disabilities and their education. So we have some examples from ASER and ITA-led research in Pakistan and from several countries where UNICEF has been carrying out its multiple indicators cluster survey. So now let me introduce you to our presenters today. First of all, Mitchell Loeb is a health scientist in the Office of Analysis and Epidemiology at the National Center for Health Statistics, the Centers for Disease Control and Prevention in the USA. His research experience focusing on disability epidemiology includes work in the US, Canada, Norway, and several developing countries in sub-Saharan Africa and Southeast Asia. Currently, he's involved in the analysis of disability statistics at NCHS and is actively involved in the work of the Washington Group on Disability Statistics and the operationalization and cross-national comparability of disability measures in surveys and censuses. Mohammed Afsan Munir is a senior research analyst at ITA and ASER Pakistan. His work focuses on disability statistics, inclusive education, and the Sustainable Development Goal 4. He has been a member of the working groups on inclusive education and special education in Punjab, and has also contributed to the country's profile on inclusive education for UNESCO's Global Education Monitoring Report 2020. Currently, he's leading an initiative to devise an SDG 4 tracking and reporting mechanism in collaboration with 3 provincial governments. Hassan holds a master's in economics from Lahore University of Management Sciences and an undergraduate degree from the Government College University of Lahore. And then Claudia Kappa is a senior advisor for statistics in the data and analytics section at UNICEF headquarters. She's the focal point for data collection, data analysis, and methodological work on child disability, early childhood development, and child protection from violence, exploitation, and abuse. In this capacity, she's been responsible for the development of survey questionnaires and data collection tools, production of estimations, development of methodologies, indicators, protocols, and normative guidelines, design and implementation of capacity building initiatives, production of data-driven reports, as well as delivery and dissemination of final results. She's also responsible for interagency collaborations and partnerships, and has been chairing or contributing to several interagency technical working groups. She represents UNICEF in the Washington Group on Disability Statistics, and contributed to development of the UNICEF and Washington Group module on child functioning. Prior to joining UNICEF, Claudia was working at the University of Geneva and at the Institute for Social Studies of the International Labour Organization. She holds an MA and a PhD in Development Studies from the Graduate Institute of International and Development Studies in Switzerland. And then Suguru Mizunoya is a statistics and monitoring specialist currently working at the Division of Data Analytics, Planning and Monitoring in UNICEF. Suguru does research in various areas, including inclusive education, primary education, and educational policy. He has been an assistant professor at the Chinese University of Hong Kong, and in the past he's served at several prestigious organizations such as the World Bank, Save the Children, and ILO, to name a few. He has a PhD in economics and education from Columbia University. So with that, we'll go ahead and ask Mitchell Loeb to start off our session with an explanation of the Washington Group, which has been instrumental in developing new tools that can be used in household surveys to get a better understanding of the status of children with disabilities. Mitch.
There we go. There we go. Thank you very much. Thanks for that introduction. I wanted to just spend a little bit of time talking about disability measurement writ large, not focusing specifically on children, as my colleagues who are presenting later will take that up, but to give you some background on how the Washington Group meets the needs of countries in developing comparable data on disability. Can we go to the next slide? There we go. I ask a series of questions here, and the first one is, why do we collect data on disability? Why do we need this information? Well, there are two large global developments in the past decades. One, the UN Convention on the Rights of Persons with Disability, that has a goal of full participation for persons with disabilities in all levels of society. And within the convention are guidelines that indicate that states parties have to collect data on persons with disabilities. If you are monitoring the rights of persons with disabilities, you need a means to identify those people and to monitor their progress over time. So that's something that's very important. The other one is the 2030 Agenda on Sustainable Development and the Sustainable Development Goals. They have an overarching goal of leaving no one behind. And part of this effort is based on indicators that need to be disaggregated by things like gender and urbanicity, age, and of course, disability status. Those two conventions lead countries to the need to collect good data on disability. Can I have the next slide? How can we tell if we've met the objectives of the convention or the SDGs? And a simple graphic illustration, this bar chart that shows a population, a subpopulation with and one without disabilities, looking at employment, the number of people employed by disability status. If those two bars are equal in height, then our goal has been met. We've reached equality. The same number of people, the same proportion of people with disabilities are employed as those without disabilities. If the bars, however, are unequal, as in this example, then our goal has not been met. We don't know why the bars are unequal. We don't know why people with disabilities are not employed or going to school or whatever the outcome is measured compared to those without disability, but we know that something needs to be done. Something needs to be addressed. And that can be also collected through good data collection. We'll talk a little bit about that later, I think. Can I have the next slide, please? So what I want to begin with is just a simple statement. How we ask questions really matters. The way we collect information on a census or a survey is all based on asking questions of participants. And the better questions we develop as survey methodologists, the better answers we get, the better data we get, the more precise, valid, and reliable information is collected. And I'll give you an example on the next slide. Here's a problematic question, and it's typical of the way people with disabilities were identified in the past. A question simply saying, are you disabled in any way, with a yes or no response? And if the answer is yes, what is your disability? Are you blind, deaf or dumb, crippled, or mentally retarded? First of all, I just have to say that those are words and terms that we don't use today. And you'll see that they have fallen from the data collection exercises that we carry out. But if you ask questions like that, and this is really based on that first question, are you disabled in any way? You get a disability prevalence of less than 1%. And this kind of approach to disability measurement is based on a medical model that identifies impairments that is also affected to a certain degree by stigma. If your culture, if the country you live in is prejudiced, or there's discrimination towards people with disabilities, there's very little incentive to self-identify as a person with disability. It's much easier to say no than yes to that particular question. Can I have the next slide, please? And this is just an example. These are historical data showing on the right side low and middle income countries, and I've selected here countries in the African region. You can see that even though these are dated, very, very low prevalence rates, all below 3.1%, many below 1%. And on the left-hand side, high-income countries in about the same time period with prevalence rates above 10% for the most part. And even though these are dated, these are old data, similar patterns still exist. And we have to ask ourselves, why? Why are low and middle income countries reporting disability prevalence of less than 1%, where high income countries report higher disability prevalence rates? Is it because there are more people with disabilities in high income countries? Or what is at play here? And one of the reasons, there are multiple reasons for these differences. Culture, understanding of disability, but one of the most important is, in fact, the questions that are answered. the countries on the left, even in those early data collections, were asking questions not about being disabled or having impairments, but about difficulties doing basic activities, an activity limitation approach. And I'm going to show you a little bit about that in the slides to come. Can I have the next slide, please? So just a little background about the Washington Group. Back in 2001, around the time that those data were collected that I showed you on the previous slide, there was a UN international seminar on the measurement of disability. And it was clear at that seminar that the data that I just showed was prevalent. There was no consistency in the way countries around the world were collecting disability data. And when the UN statistical system, in particular the Commission, is met with that kind of problem where countries are not uniformly collecting data that can be compared, what they do is they set up what's called a city group. They say to the members of the Commission, which are statistical offices around the world, you need to get together and solve this situation. So the Washington Group was established back in 2001, 2002 to address that need for reliable and comparable population-based measures of disability. We wanted to foster international cooperation in the area of health and disability statistics and produce internationally tested measures to monitor the status of persons with disabilities. Exactly what we need to monitor the convention and the SDGs. And we want those measures to be incorporated into national statistical systems. So the disability becomes a routine measure. It's captured on surveys as routinely as gender and age, marital status, urbanicity, disability status is right up there. Can I have the next slide, please? So this group, the Washington Group, is owned by countries. National statistical offices are solicited every year for membership in the Washington Group. And currently there are about 133 countries and territories that have identified someone from the statistical office to be a member of the Washington Group. Not all of them are active, not all of them participate in meetings and webinars and email, but these countries have shown interest in the work of the Washington Group. There are also international organizations like the World Bank, WHO, UNICEF, UNSD, and others, as well as organizations that represent persons with disabilities. There's a very small secretariat for the Washington Group that's located here in Washington at the National Center for Health Statistics. That's where I work. We have a steering committee made up of members from different regions that oversees the Washington Group work plan, and work groups that carry out the work plan that we've established. So we get input from all members. We've established an emphasis on evidence and transparency with extensive testing of data collection tools in multiple countries. Because there is no gold standard for the measurement or collection of disability data, we have to make sure that the tools we develop are fully tested. That's the validity in the testing of the questions. Can I have the next slide, please? So I want to just mention how our understanding of disability has changed from decades ago when we were looking at a social model of disability to the current situation today. And there's a few things that I want to just point out. One is that disability is understood as a process rather than a static state or a condition. What that means is that a yes-no response to a question doesn't really capture the fullness or the breadth of disability in a population. And while your disability, your impairment may not change, your ability to function in society can change as environments are adapted. And all of this reflects the shift from a medical model, an impairment-based approach, to a social model, a human rights approach that focuses more on participation and the equalization of opportunities. What that does is it shifts the focus of disability from within the person. So we don't want to, we're not out to fix a person with an impairment. There are adaptations at the person level, but that's not the goal of disability measurement. It's really looking at how the environment may be creating barriers to participation. So we want to focus on accommodation and universal design, shifting the focus from within the person to within the environment that the person lives in. Can I have the next slide? And that change in thinking means that we have to change how we collect disability data. We have to move away from that dichotomy that I told you about, disabled versus non-disabled, to begin to try and describe a continuum of functioning. And if you think of functioning along a continuum, you have at one end a person who has no difficulty doing anything at all, to at the other end of the spectrum, a person who has a lot of difficulty, severe difficulty doing multiple things, and everything in between that. What we have to do is we have to begin through data collection, through the development of questions, to capture that continuum. We want to begin to describe that. And based on those indicators that reflect the continuum, we then want to be able to disaggregate outcomes by disability status. So it's a bit of a, I don't want to say it's a complex process, but it's a very well thought out process. Okay, the next slide. So where are we today? Remember the question that was asked before, are you disabled in any way? Now we're looking at disability conceptualized as the outcome of an interaction between a person's functional limitation, their difficulty doing basic activities, so the interaction between that and an unaccommodating environment that results in an inability to fully participate in society. And you can see just from that kind of definition, we're looking at something more complex than just, are you disabled? We're looking at a person's functional limitations, their environment, and their participation. We're not looking at a medical diagnosis or a condition. We're not looking at impairments. So we're moving it outside the body, outside the medical realm, into activities, participation, and the environment. Can I go to the next slide? And this is conceptualized in what is the ICF model of functioning, disability, and health. That is the WHO's what is it called? ICF, the framework. Thanks, Claudia, for disability. And you can see that all of those elements that I just talked about are within this framework. There is an underlying health condition. So that medical part is still there at the top of this model that impacts a person at different levels, at their body function and structure. There again is the medical association in impairments. In the center are those activities that a person can do or might be able to do, and limitations on those activities, and the resulting participation or any restrictions on participation. And all of those are impacted or affected or modified by environmental and personal factors. This is a complete model of functioning and disability. And as one of my colleagues mentions, it is a survey methodologist's nightmare, with arrows that go both ways and this sort of spider's web of a model. It's clear, but when you're developing questions for a survey, it creates confusion. So what the Washington group did on the next slide, if I can show that, is focus right there in the middle, that green part, activity limitations. Sorry, go back one slide, 2 slides. Can you go back? One more. There we are. We wanted to focus there on activity limitations, understanding that people who have difficulties doing basic universal activities will, in an unaccommodating environment, have participation restrictions. They will be at risk of restricted participation in an unaccommodating environment if they have those limitations. We're only asking questions on that green part in the middle. Can I go to the next slide? So these are the questions, the first question set that we developed. It's a short set of 6 questions that looks at 6 different functional activities: seeing, hearing, mobility through walking and climbing, cognition through remembering and concentrating, self-care, like washing all over and dressing, and communicating. Those are 6 basic activities. They're universal, they're relevant in every country, in every culture, in every language. And we have 4 response categories: no difficulty, some difficulty, a lot of difficulty, or cannot do at all. So you can see, if we refer back to that first question, are you disabled in any way? Yes or no. That's a simple question with a dichotomy that gives poor results. Now we have 6 questions with 4 answer categories. There's a multitude of depth here. And we can begin to describe that continuum of functioning from no difficulty doing anything to a lot of difficulty or cannot do at all, multiple domains. So we have that ability here. We know that this doesn't cover everything, but it does give us a good estimate of functioning in a population. We can talk about what's missing a little bit later if you're interested. But I'll go on to the next slide. And because the short set that I just talked about doesn't fully describe all of the functional domains that may exist, we also developed an extended set with additional questions that look at psychosocial issues and upper body functioning, and begin to look at the use of assistive devices and functioning with and without assistance. The short set was 6 questions. The extended set is as many as 35 questions. We know also that the short and extended set, neither of them is ideally suited to functioning among children. So with UNICEF, we developed the child functioning module for children 2 to 17 years old. Claudia and her colleague will talk more about that in a little while, but that gets at the full range of childhood disability and domains that are important to child functioning. We also, with UNICEF, are looking at an inclusive education module that will be important for this group in particular. That's in the final testing stages. With the International Labor Organization, we've begun to look at, or we have adopted recently, a disability module for labor force surveys. Those last 2 begin to look at the environment and participation. They begin to answer the question, if we have found that there is inequality among people with disability in education or employment, these modules begin to answer the question, why? What are the barriers to participation? And we're also looking at a more detailed module on psychosocial functioning and mental health. That's still in its early stages. And next slide, almost done. So what we wanted to do is we wanted to mainstream disability statistics. We want to get these simple questions onto surveys routinely so that monitoring the SDG indicators and the convention will become routine. All that is required is that you identify the data collection systems that will be used to monitor population-based SDG indicators, for example, and then include one of the Washington Group question sets into those data collection systems. It may be the short set, the extended set. There are other sets we have, like the short set enhanced that I didn't talk about, or the child functioning module. If you include those, once those questions become integrated into those core statistical systems, then information on disability becomes routinely available for all government agencies and civil society. And the disaggregation of outcomes like education and employment by disability status becomes routine and sustainable. And the last slide. There you go. Just leading you to our website that has a wealth of information. We're updating it. It'll be changed soon, but it is, there's a lot of information there, a lot more than I could present today. And our email address, if you have any questions that can't be answered during this webinar or something that comes up later, don't hesitate to email us. We'll answer your questions as quickly as possible. Thank you very much.
Great, thank you very much. I think that sets the stage very nicely for the other presentations. So with that, we'll hand over to Afsan, who is going to tell us about the use of the state of some of the Washington Group questions in household surveys in Pakistan. Afsan.
Thank you so much, Stuart. Hello, everyone. My name is Afsan, and I'm affiliated with. Can I have the first slide? This one is not mine. Yes, thank you so much. So my name is Afsan, and I'm affiliated with Idare Talim Agahi and ASER Pakistan in the capacity of a senior research analyst. So before I actually jump into the presentation, I would like to thank the GPE webinar team for organizing this very important series of webinars on children with disabilities. I would also like to acknowledge the support and guidance which has been provided by Professor Nidhi Singhal and Professor Ricardo Supadis from the Faculty of Education, University of Cambridge, Dr. Meghna Nag Chaudhary, Research Fellow at University College London, and Ms. Bela Raza Jamil and Ms. Sahar Saeed from ITA and ASER Pakistan for this research study. So in today's presentation, I'll be sharing our experience of using the child functioning module in Pakistan and the evidence on children with disabilities that this activity has generated. Just to give you guys a brief overview of what ASER is, as most of you may already know, the Annual Status of Education Report Pakistan is a citizen-led movement which generates the much needed evidence on learning outcomes, access, equity, quality, and other educational indicators through a national large-scale household level survey. The ASER survey includes the assessment of learning outcomes of children within the age group of 5 to 16 years in all rural and a selected sample of urban districts of Pakistan through direct child assessment and informs policymakers of regarding this domain. Therefore, it bridges the data gap that exists in this particular domain. Last year, we had a sample size of over 90,000 households. And from these 90,000 households, we had approximately 260,000 children within the age bracket of 5 to 16 years. Moreover, we have also collected information on the functional difficulties using the short set of questions in the past. This year, we also plan on piloting the assessment and collecting information on disability status at the ECE level. Next slide, please. So moving on to the background of our work on children with disabilities, we realized that there was a lack of credible data on disability prevalence and learning outcomes of children with disabilities. And because of this realization, we decided to undertake this study. The existing data sources that we had prior to this study have used different non-standardized questionnaires and methodologies, which has resulted in huge variations in the prevalence rates. To give you guys some of the examples, National Population Census in 1998 states the disability prevalence rate of 2.48% among the total population, which has now reduced to 0.48% in the population census of 2017. The census results do not provide us with much information as far as the incidence of disabilities is concerned, as the questions asked in the census were binary in nature and thus did not capture the type or the extent of a disability. Moreover, it is also expected that in societies such as that of Pakistan, where persons with disabilities are usually stereotyped, respondents wouldn't have been really forthcoming about the disability status of themselves or their loved ones, which could have resulted in underreporting of the incidence rate. Other estimates, such as that from the World Report on Disability from 2011, show a much higher prevalence and disability incidence rate in the country. Focusing specifically on children, the MEX Punjab 2018 survey and the Teach survey 2018 in Punjab show disability prevalence rates of 17.9% and 11.2% respectively. Both of these surveys have used the child functioning module. The difference in the incident rates from both of these surveys is only due to the difference in the targeted age groups and the scale of the surveys. Otherwise, the trend is found to be similar as far as the types of disabilities or difficulties are concerned. With varying results from different sources, it is imperative to have a standardized set of questions on disability. For this purpose, the child functioning module has been found to be effective and is recommended by the United Nations for identifying children with disabilities, especially to support the disaggregating of data for various purposes. Now, being a self-reported tool, the child functioning module does not give a formal diagnosis. Rather, it identifies children who are at a greater risk than the general population, which means those individuals who are experiencing limited or restricted participation in society. As I've already mentioned, a large-scale study such as ours was needed since not much information and data existed at that time with regards to children with disabilities and prevalence of different types of difficulties across provinces. Therefore, there was a need to fill that gap, and so ITA, in collaboration with the respective government departments, DFID, Faculty of Education, University of Cambridge, Sightsavers International, FPSF Pakistan, and IDS Pakistan decided to undertake this activity. Can we move on to the next slide? So with this context in mind, ASER Pakistan's studies set in two of the most densely populated provinces of Pakistan, namely Punjab and Sindh. We have covered 5 districts across these 2 provinces. The covered districts are Lahore, Karachi, Multan, Hyderabad, and Bahawalpur. These districts were selected for the geographical spread that they provide. For the purpose of this presentation, we have used data from a household level survey, which has utilized the child functioning module along with a household observation sheet. Excuse me. As part of the survey, we have adapted and translated the child functioning module for 5 to 17 years old and have used it for 5 to 16 years age group in order to be aligned with the mainstream ASER survey. The survey has covered almost 3,000 households, and from these 3,000 households, we found 8,345 children within the age group of 5 to 16 years. In 2,000 and in approximately 2,500 households. Over the course of this presentation, I'll be sharing with you a descriptive statistical analysis which is focused on 13 types of difficulties ranging from the physical to psychosocial, developmental, and behavioral difficulties that a child might be facing. Through this, we will be exploring 13 types of difficulties and the impact that this may have on school practices instead of focusing on difficulty as a singular construct. Moving on to the next slide. So can you please press next? Some part of the slide is missing. Okay, so for the purpose of this survey, we have translated the child functioning questionnaire into Urdu language, which is the national language of Pakistan, and an excerpt from that particular survey is also shown on this particular slide. So Urdu is widely understood and is the national language of Pakistan. For those of you who are not familiar with the child functioning module, all of the questions are asked of child's parents or primary caregivers to focus the respondent on the functioning of their own child with reference to that child's cohort, where appropriate questions are prefaced with the clause compared with children of the same age. Each question then has multiple choices, with each option reflecting the extent of difficulty. Next. Next. Okay. So in order to make the questions easy to understand and relatable for the local population, the examples were modified a bit where appropriate. For instance, the questions on mobility ask if a child can walk or run 100 meters or 500 meters with and without support. This may be problematic in countries such as Pakistan due to a couple of reasons. Firstly, people may not know the approximate length which 100 meters or 500 meters represents. This is particularly true for the rural areas in Pakistan. Moreover, a football field, which is the example given in the child functioning module, is not that appropriate for Pakistan, where this sport is not that popular and people do not really know about this particular sport that much. So secondly, units of measurement also vary by region and district in Pakistan. So a meter might be longer in one district than others, so that would have been a bit problematic for us. This necessitates that some examples are provided to the respondent accordingly for the purpose of clarity. In our case, we have used examples such as houses, courtyard, corner of the street, nearby mosque, temple, or church, among others, and have trained our enumerators to use the same. For training of the enumerators, we developed a training manual which clearly specified the do's and don'ts of each questions for each of the questions. This training manual was further complemented by a training video in which different situations were enacted for better understanding of the enumerators. After the trainings were conducted, the survey was finally done in late 2018 and early 2019. Next, please. We can move on to the next slide. So this, next please. So this brings me to the findings. Please press next again. Thank you. So this brings me to the findings. One thing that I would like to point out here is that the moderate and severe levels have been aggregated in these findings for the sake of simplicity. As shown in the figure, anxiety is the highest reported difficulty, with 8% of the children being reported as being anxious, nervous, or worried daily. On the other end of the scale, only 0.3% of the children were reported to have hearing difficulties. Similarly, difficulties such as hearing, seeing, communication, walking, learning, self-care, and remembering were reported with prevalence only up to 2%. On the other hand, difficulties in concentrating, accepting change, making friends, depression, behavior, and anxiety were reported with much higher prevalence rates within the range of 5% to 8% of children. So in terms of gender, the high prevalence of depression and anxiety among girls and the high prevalence for difficulty in behavior reported among boys were the only statistically significant findings as far as the gender is concerned. For all other difficulties, there is no statistical difference in the prevalence between boys and girls. Next slide, please. Thank you. So as far as the differences between the two provinces are concerned, there is a higher prevalence in Punjab than that in Sindh for most of the dimensions. The three exceptions to this trend are that of hearing, remembering, and self-care, where we have found high prevalence in Sindh. However, amongst these three dimensions, only self-care is statistically significant. For the remaining 10 dimensions, where the prevalence rate is higher in Punjab, excuse me, provincial differences for 8 were found to be statistically significant. The difference in the prevalence between Punjab and Sindh is about 3 to 8 percentage points more in Punjab region, particularly for 6 dimensions, including making friends, depression, anxiety, concentrating, accepting change, and behavior. Can I have the next slide, please? Sure. So, since in majority of the cases, mothers were the main respondents on child's functioning, their educational status was of interest for us. 56% of mothers in our sample claimed to have attended school. So 9 out of the 13 difficulties were reported more by mothers who had attended school when compared to those who had not. But for only 2 of these difficulties, which were depression and anxiety, the differences were statistically significant. Difficulties in 4 dimensions, including making friends, concentrating, accepting change, and behavior, were reported more by mothers who had not been to school. Differences in the estimates of all of these 4 difficulties were found to be statistically significant. Next slide, please. Next. Thank you. So we also wanted to see if there are any differences in the school enrollment of children with and without difficulties. Around 80% of the children without difficulty in our sample are enrolled in school. It is interesting to see that children who are facing moderate to severe level of difficulties in 10 out of the 13 functionings have lower enrollment levels relative to children who do not have any difficulties. This is shown by the blue bars on this particular figure. As an example, the graph tells us that children with moderate to severe difficulties in communication are approximately 20 percentage points less likely to be enrolled in schools than children who do not have any difficulties. In terms of statistically significant differences, we have found that children with moderate to severe level of difficulties in communicating or learning or walking are less likely to be enrolled in schools, while children with moderate to severe difficulties in anxiety or depression are more likely to be enrolled in school than children without any difficulty. So this is really interesting. Although statistically insignificant, it is important to point out that for children with difficulties in hearing and seeing, large margin of differences are estimated in school enrollment relative to children without difficulties. So for children with hearing difficulties, they are 17.4 percentage points less likely to be in school relative to children without difficulties, and children with difficulties in seeing are 11 percentage points less likely to be enrolled in school when compared with children without difficulties. So these are large differences, but given the small prevalence of these difficulties in the data, these differences are not statistically significant. Next slide, please. So this slide shows the type of school that enrolled children with difficulties were reportedly attending. We can see that for all of the functionings, more children are enrolled in government schools relative to the private schools. This is similar to the trend which we observe for children who are reported as not having any difficulties. I would also like to point out that children with difficulties in self-care had a high enrollment rate in private schools. It was still less than the enrollment in the government schools, though. So, yeah, moving on to the next slide. So what insights can we actually draw from our experience? As mentioned earlier, we have found high prevalence for some difficulties in Punjab relative to that in Sindh. The survey did not explore the why aspect of the significant differences between the two provinces. Nonetheless, we can hypothesize about the potential reasons, which may include varying quality of nutrition and differences in the quality of healthcare facilities. Moreover, it is our own understanding that the differences might have been due to the varying awareness levels within each province with regards to openness towards sharing child's difficulties. This may have been lacking in the selected districts of Sindh, due to which we may have had underreporting of difficulties in this particular case. Moving on, children with difficulties in communicating or walking or learning are less likely to be in school relative to children without any difficulties. In addition to this, children with moderate or severe level of difficulties were found to be more likely to be attending government schools. So as a result of this survey, here's what we have learned about the use of Washington Group's child functioning module. Number one, the module is easy to implement in the sense that the enumerators do not have to be experts in disability. The only requirement is that the enumerators are trained well on how to proceed with the questions. Secondly, the questions are framed in such a manner that it becomes easier for the respondents to comprehend them and to respond to them. And lastly, although a formal diagnosis is warranted in many cases and can be followed up on a need basis, using child functioning module is a cost-effective way for the identification of children with disabilities to begin with. Next slide, please. So lastly, I would like to share some recommendations, policy implications, and future directions which are derived from our study. As a result of this study and others, the government sector has realized that the official categories of disabilities, which currently covers only visual, hearing, physical, and mental disabilities, need to be expanded to include other types of disabilities as well, in that we cannot treat disability as a binary notion. This means that now more children with disabilities can be identified and thus may be mainstreamed in an effective manner in the mainstream educational system. Secondly, the findings from our research have also informed the Punjab Special Education Policy, which was launched today, and the inclusive education strategy in Punjab. I would like to highlight the fact that inclusive education strategy for Punjab is the first of its kind document on inclusive education in Pakistan and is currently being finalized. Once done, it will become the first policy level document on inclusive education in Pakistan. Our research is relevant to both of these policies, as we have found that a significant majority of children with difficulties is sitting in a regular school, which raises the question of what facilities they are being provided with, in those particular regular schools for their learning, and are they learning anything at all to begin with? Apart from this, the education sector plans for Punjab and Sindh have also benefited from our research to facilitate the learning of children with disabilities in a better manner. Thirdly, in addition to the household level survey, we have also adapted the ASER learning assessment tools into Braille and Pakistan Sign Language in order to assess the learning outcomes of children with visual and hearing impairments. The adapted tools have now been piloted in 20 special education schools across Punjab and Sindh. Moving on, the 2019 round of ASER Pakistan survey has included questions on disabilities and relevant facilities in the school observation sheet. The information from this will also prove to be useful for all stakeholders. To conclude, we are also tracking the progress which Pakistan has made with regards to SDG 4 in collaboration with the respective school education departments and with support from the Open Society Foundations. Tracking the educational indicators of children with disabilities is an important aspect of this activity as well. Next slide. So with this, I would like to thank you all for your time and look forward to any questions that you may have. Thank you.
Thank you very much, Afsan. A really fascinating insight into the work that's ongoing in Pakistan. So now I'll hand over back to Claudia Kappa, who's going to start on the UNICEF presentation. Claudia.
Yes.
There you go.
Thank you very much. Let me start my presentation by thanking the organizer of this webinar for giving us the opportunity to present. I will present on the general introduction related to the child functioning module, building on the presentation from Mitch, and then my colleague Suguru Minuzoya will provide an overview of the findings. In our presentation, we would like to share with you the experience of using the child functioning module in the multiple indicator cluster survey. Next slide, please. Let me start by giving you an overview of the multiple indicator cluster survey, or MIX for short. This is a survey program that was developed by UNICEF to assist countries in collecting data on children and their families across a number of different indicators of well-being. It is a global program that has been designed by UNICEF but is implemented at the country level by national statistical offices and other official government counterparts. So UNICEF provides financial and technical assistance, but the implementation of the survey and the decisions related to when to implement and what type of questionnaires are included are completely handled at the country level by the national counterparts. In other words, this is not a UNICEF survey. These are independent national household surveys conducted across the world by different national statistical offices. UNICEF again provides technical and financial assistance together with other partners. And this technical assistance also takes the forms of data collection instruments and questionnaires that we develop in consultation with many different experts and partners. And as part of this collaboration, UNICEF joined the Washington Group on Disability Statistics in 2011 with the specific intent to developing a joint module on child functioning that can be used in household surveys. Now, MIX has been conducted at regular intervals, and we are currently in the 6th round of the multiple indicator cluster survey program that is expected to be implemented in 58 countries across the world. When the child functioning module was launched in 2016, it was launched for use by any household survey program. It was not only designed for use in the multiple indicator cluster survey, but it can be used in different household surveys program. At the mixed survey decided to adopt the child functioning module and integrate the child functioning module into the standard tools that are proposed to countries for data collection. And I must say that the child functioning module is one of the most popular questionnaires because, again, it's up to the countries to decide what modules to integrate in their data collection efforts as part of mixed. And the child functioning module has been systematically picked up by countries and used for data collection. For more information about the multiple indicator cluster survey, I will encourage you to visit the dedicated webpage mix.unicef.org, where you will find information about the countries that are implementing the mixed surveys. You will find the tools that are used, including the questionnaire, the syntaxes for analysis, and the template for reporting. Now, going to the next slide, I wanted to give you a more detailed overview of the countries that are overlapping with the GPE countries across the 4 GPE regions in terms of the mixed surveys that are being conducted or have been conducted in these countries, and also the availability of data related to child functioning. As you can see, there are countries that have implemented or are in the process of implementing mixed survey across the 4 regions, the 4 GPE regions. And you can see highlighted in orange the countries for which we already have available data, meaning the data sets and the survey reports are available for readers to use. They are, again, on the website that I mentioned earlier, mix.unicef.org, where users can develop the original data sets as well as all the accompanying material. So among the countries for which we already have available data that can be downloaded, there is Gambia, Sierra Leone, Madagascar, Kyrgyzstan, Mongolia, and Pakistan. And you also see in green some countries for which the data are about to be released, including Bangladesh and Georgia. You also have countries that are still in the process of finalizing their results, or for which data collection has not started yet, but is expected to start very soon. So we are going to have a wealth of data coming from these different countries across the four regions. Now, going to the next slide, I would like to go back a little bit to this concept of disability and how we try to operationalize the concept of disability for the purpose of developing the child functioning module. Again, building on the 2 presentations that went before me, I just wanted to again reinforce the concept of functional difficulty, because this is really the pillar, the center of the child functioning module. So how do we conceptualize disability within the child functioning module? It goes back to the concept of activity limitation that is embedded in the International Classification of Functioning. We are focusing on what the child is able to do, or the difficulty that the child can have in performing certain daily tasks, in certain basic functioning. For instance, in the case, let's take a concrete example, we are specifically focusing on the difficulty that the child can have in seeing. So this is the core of the question. So we are not asking the mother to focus on impairment. We're not asking the mother to provide a diagnosis, because obviously this type of information is not something that the mother might have available. But the mother of a child is able to say whether or not the child has difficulty seeing. And obviously this difficulty seeing can be the result of, for instance, different conditions. It can be the result of a disease, for instance, that was left untreated. So there can be different origins or causes behind the difficulty, but the mother is able to report about the difficulty in it. Now, a difficulty like difficulty C in an accommodating environment where the child, for instance, does not have access to glasses, might become an impediment to the child in terms of his participation in school, for instance. Because a child without glasses is likely to be unable to see the board, for instance, and therefore to participate in the different educational activities. And as a result of that, for instance, the child might be dropping out of school or might remain in school but still not being able to learn due to this unaccommodating environment. Obviously, in an accommodating environment, a child who has difficulty seeing that can be addressed by glasses, and provided that the glasses are made available to him or her, this child can possibly participate in school activities and therefore enjoy his or her right to education. Now, going to the next slide. So this is the graph that Mitch showed, which very clearly pointed at the center of the ICF. And as you can see, and as Mitch mentioned earlier, the child functioning module was developed to capture the activity limitations. But we are also developing a new module, as Mitch said, that is specific, has a specific focus on inclusive education. And this module on inclusive education is going to be able to capture participation restrictions. The module is structured in three main parts. There is a first part that looks at attitudes vis-a-vis children with disabilities, attitudes when it comes to inclusive education. And it's a module that is intended to be used and applied to all respondents, regardless of whether they have children, regardless of whether their children have a functional difficulty. Is meant to capture at the population level the general attitudes vis-a-vis inclusive education and children with disabilities when it comes to educational opportunities. Then there is a second component of the module that is meant to be applied to parents of children who are currently attending school. Again, all children currently attending school. And this module meant to gather information through the knowledge and the eyes of mothers or primary caregivers about the school environment where the child is currently fulfilling his right to education. So the module asks questions about the infrastructures, about the curricula, about the costs associated to sending the child to school. And this module, again, is relevant and applicable to all children, regardless of their functional difficulties. But obviously, when this module is used together with the module on child functioning, will allow users to understand the particular challenges or barriers that children with functional difficulty might experience in a school environment. Then there is a third component of the module of inclusive education that is meant to be addressed to parents of children who are not currently attending school. And this part of the module aims at understanding whether there are certain specific barriers that prevent that child from currently attending schools. And of course, this ability, or at least the inability of the educational system to accommodate the needs of children with functional difficulty, is addressed as being one of the possible barriers, and there are specific questions that aim at understanding whether these are the reasons why the child is currently out of school. So you see two modules coming up, one already released that really aims at identifying children with functional difficulties, and the second module that aims at capturing the environment, and particularly in the context of education, that might be the reason why the child is unable to fulfill in full his or her right to education. Now let's go to the next slide. So these are the different functional domains that are captured by the child functioning module. And again, this was beautifully illustrated through the data coming from Pakistan. But what I wanted to highlight here is the fact that with the child functioning module, we really try to put the emphasis on domains of functioning that have been traditionally overlooked in previous data collection efforts. Previous data collection efforts had a significant emphasis on the more traditional functional domains pertaining, for instance, to vision and hearing or walking and mobility. With the child function module, we really try to capture a broader set of functional domains that are particularly relevant to children, and they are particularly relevant in the context of education. So we included domains that, in line with the ICF, that focus on learning in the forms of, for instance, learning, concentrating, remembering, for instance. But we also look at domains related to emotions, management of emotions in terms of anxiety, for instance, or experience of depression, a controlling behavior as well, making friends. So as you can see, an expanded set of functional domains that, as you will see in the data, prove to be particularly important when we are looking at data related to education, because these functional difficulties related to emotions and management of behaviors do have an impact on the child's ability to relate to peers and to learn. Now, we keep receiving questions about, can we have a short set of the child function module? Can we drop some modules or some domains? Well, if you drop domains, you drop children with functional difficulties. Because if you don't include certain domains, you are not likely to pick up children who have difficulty in those domains. And those domains are indeed critical, particularly, again, when it comes to learning and education, and specifically because they've been overlooked in the past. So focusing on just seeing or hearing or vision, or walking with results in lower level of functional difficulties, because you are excluding from the data collection children who might have functional difficulties in other domains, and these other domains are equally important to the understanding of the barriers and the difficulty children with disability face. I'm going to stop here, and now I'm going to give the floor to Suburu, who will give you an overview of the available data. Thank you.
Yeah, the rate of children with functional difficulties across countries. As you see, there is a huge gap between the countries with high prevalence rate and the low prevalence rate. And even though if you fix the questionnaire and the methodology of data collection, you will still see variations because you cannot fix certain elements surrounding children, such as culture, conflict, poverty, and living standards. And can you go next slide, please? Yes, but in general, this is a common pattern across countries where you see that the anxiety, controlling behavior, accepting change, and depression shows a quite higher rate of functional difficulties, whereas more physical domains tend to show lower prevalence rates. And overall, we expect around 10 to 20% of prevalence rate in total. But once you disaggregate, you see there are huge variations in terms of functional difficulty rates. Can you go next? And here I'm showing two graphs. The graph on your left-hand side shows the adjusted net attendance rate of children with and without functional difficulties. The bar represents the adjusted net attendance rate of children with any functional difficulty. And the dot represents the adjusted net attendance rate of children without functional difficulties. So when it comes to 1 year before primary, which is the last grade of ECE or pre-primary education, which is 4.2.2 global indicator, there is no difference. And then when it comes to primary, there are some difference, but it's very close, 40% net attendance rate in Tunisia, and the 32% for the children without children without functional difficulties. And again, at the lower secondary level, the difference is very small. The main message is that like once we adapt the concept of child functioning module, then the children with functional difficulty is much larger group than we traditionally think of children with disability. So we don't expect to see a huge differences between children with and without functional difficulties in terms of access to education. So the inclusive education should mean that both the providing access to education for those who are out of school children, but also providing proper education tailored for the type of difficulties they have, because there are a lot of children with functional difficulties in the education system. On your right-hand side, you are seeing the dropout and repetition rates between children with and without functional difficulties. When it comes to dropout, there are some variations, but what we see across country is that variation is very small. But when it comes to repetition, there are some countries where you see a much higher repetition rate among children with functional difficulties. So we are seeing evidence that actually functional difficulty is affecting the type of learning in education. We don't have very concrete, rigorous evidence yet, but about half of the country that we have data shows that children with some kind of functional difficulties have higher repetition rate. So we are hypothesizing that this is due to the fact that these children are not learning. Can you go to the next slide, please? Okay, now, so before I show the final graph, I want to explain what we mean by learning. In the mixed survey, we have adapted new module to measure foundational learning skills among children aged between 7 to 14. And this is SDG 4.1.1a indicator if we when we report the foundational learning skills among children who are grade 2 and 3. What we are measuring is two skills. One is literacy and numeracy skills. And we adapt questions so that you can compare results across countries. And then now you are seeing what kind of questions are being asked to children. For literacy, the first one is decoding, if children can read sentences or the paragraphs or a story. And the second question is interpretation of the story. Children will be asked the fact from the story. And the third questions are about inference. So children have to guess or find answers from the context of the story. And for numeracy, we have 4 types of questions. One is the number recognition, just to read numbers. The second one is discrimination. Children need to tell which number is bigger, 11 or 7. And the third one is addition. And the fourth one is pattern recognition, 2, 4, 6. And what's the next number, which is 8. Okay, can you go next slide, please? Right. So again, we have a result from about 10 countries, and the result varies. We need to have more deeper, rigorous analysis, but we are seeing that in general, children with any functional difficulties tend to perform lower than children without any difficulties. But the issue is that the degree vary across countries. In some countries like Sierra Leone, where the national average of share of children with foundational skills is very low, about 12% for numeracy, 17% of reading. So you can't, there's a floor effect that's how low you can go. So the difference is very small or marginal. But when you look at the countries with much higher standards in terms of learning outcomes, then you tend to see a bigger gaps, such as in Kyrgyzstan. Reading, the gap is about 70 percentage point, and numeracy gap is about 14 percentage point. So like we are getting the information about the children with functional difficulties, not only in terms of access to education, but also the learning outcomes as well in mixed 6 survey. And they can go next slide, please. And then that will be it from my side. Thank you very much.
Great. Thank you very much to all of our presenters. I think we've had some really interesting information there. We have a number of questions from our participants on the YouTube channel. And maybe to start us off, there's a question about EMIS, so Education Management Information Systems, and whether we can adapt the disability data questions which you've discussed today for household surveys and ask them, for example, from head teachers, and whether that's an accurate way of gathering data. And I just point the people who are interested in this to the webinar that we held back in October, which was on this exact theme of using disability questions in EMIS. But perhaps I'd go to Claudia and Mitch to see if you have any response about using Washington Group or Child Functioning Module style questions in EMIS.
Or unmute. There we go. Just waiting for the unmute. That's a very interesting and very relevant question. And we were, the Washington Group was challenged, in effect, to try and adapt the child functioning module for use by teachers in a classroom setting. And with the collaboration with Humanity and Inclusion, we've begun to look at that a slightly, I know that Claudia said you can't reduce the child functioning module. What we've done is we've made it simpler for teachers to be able to use. Teachers are different informants than parents. And the information they provide is important, considering that children spend a good deal of their day and week in school. And we wanted to be able to adapt the module to be able to use by teachers in a classroom setting. The initial feedback we've received is that it is possible. Teachers in a small test in Senegal were able to carry out the survey, to ask the questions, and to get valid and reliable results. To me, one of the most interesting outcomes of that particular test was the fact that teachers reported that they got to know their students better than they had prior to applying the child functioning module. And this is something that could be embedded in an EMIS for routine collection of data on functioning for children. Over time, monitoring children's performance based on their functioning and meeting their needs within the classroom. Claudia, maybe you have something to add?
Yes, so building on what Mitch said, for 2020, we are planning some additional testing to specifically see the implication of including this questionnaire in EMIS, also from the point of view of logistics and administration and possible cost and burden on the EMIS system. So there's going to be two streams of work, one continuing on what Mitch has said in terms of testing the use of the module with a respondent that will be other than the mother or primary caregiver, and see under which conditions, for instance, school personnel is able to provide accurate information about children, and also testing the implementation aspect of including the questionnaire in EMIS from the point of view of really the logistics of having these additional questions integrated into EMIS system. So if there is a specific interest among participants in terms of suggesting countries where this test could take place, we will be happy to discuss possible collaborations. Thank you.
Great. So I just ask one more question and ask for a quick response if you can, because we're running out of time, unfortunately. So there was a question about local language and the strategies which were used in Pakistan to train enumerators, given that it's often challenging to translate these disability-related questions into local languages. So perhaps Afstan, you'd be able to comment on the challenges of training enumerators and translating the questions.
Sure. Responding to Purna's question on the translation and how did we train the enumerators. For the translation of the module, we translated in a way that the meaning of the actual question was not lost during the translation process. We then had it verified from a panel of experts who could understand both languages, which are English and Urdu. After which we piloted it first to see if the translated questions were providing us with reliable estimates. Once we were sure that the translation has been done appropriately, only then we moved ahead with the survey. As far as the training is concerned, we used training manuals which were developed in collaboration with the Real Center. And those training manuals included guidelines for each of the questions, the do's and don'ts for each of the questions within the child functioning module. A video was also developed for explaining each question in a better manner. Lastly, we held rigorous trainings, which also included visits to the field as part of the training. Regarding how did we deal with the issue of disability versus difficulties and that particular aspect, we had to explain the difference to our enumerators and had to sensitize them regarding the same to ensure that the term disability is not used during the entire survey. So the tool which we actually utilized was sensitization, and there's no other way to do that, at least here in this particular context. So we had to go ahead with the sensitization process as well.
Great, thank you. So we do have some other questions. Unfortunately, we're going to have to wrap up now because we're running out of time. I would maybe encourage our presenters to take a look at the YouTube channel perhaps later today and see if they can give a response to any of these other questions that are there. And several of the questions have been asking about particular resources on the child functioning module in the Washington group. So we will be circulating all of the resources from this webinar later, along with a summary of the discussion today. So with that, I'm just going to thank all of our presenters enormously. We're very grateful to you all for joining us today and for providing these insights. I think we've learned a lot about how we have a set of working tools now which are already providing useful data on children with disabilities, including their learning outcomes and their educational participation. But there's clearly still sort of work in progress in how these are applied in different countries, how they're translated, and how they can be used, for example, in MS systems as well as in household surveys. With that, I'll thank our presenters and all of our participants today. And say goodbye for now. Thank you.